As I mentioned, my shift's going to be ending, and Joanne's going to be taking over for me.
Hello. Hi, my name is Joanne. I'll be Mr. Jervis' nurse this afternoon. So I'm just going to get a report from Jamie. If you have any questions in between or after, just let us know. We'll answer it. Okay?
This is Mr. Gervais.
Mm-hmm.
He's a 79-year-old gentleman. He's had general malaise over the past few months, increasingly short of breath over the past few weeks. Was extremely short of breath today. 911 was called.
Okay.
When they arrived, he was tripoding, short of breath. His pulse ox on arrival was 69%. He bradied down to a PEA arrest. They did 2 rounds of CPR, and there was a return of pulses in 8 minutes. And he was intubated in the field. He was brought into our hospital. Give you a little bit of history of Mr. Gervais. He has a history of diabetes, hypertension. He had thyroid cancer back in 2006, which was his thyroid was removed, and also received a local radiation then. He has an allergy to penicillin, and he's currently on the hypothermia protocol post PEA arrest.
Okay.
Just to go over some of his vital signs, his blood pressure is 120 over 70. His pulse right now is 66 in sinus rhythm. His respiratory rate is 16 breaths per minute, and his temperature is 33 degrees Celsius, which is adequate on the hypothermia protocol. Neuro-wise, he is sedated on Bedside for sedation. He's also on fentanyl for pain control. And because he was shivering, we started him on Nimbex as well. His pupils are 1 and non-reactive, which has been consistent since he's been in the hospital. His vent settings are assist control.
Assist control.
40%.
40%.
Rate of 16.
16.
Tidal volume of 550. And a peak of 5.
Okay.
His lung sounds, he has rhonchi throughout bilaterally. He does have moderate amount of tan, thick secretions. We did send a culture away, and the results are pending.
Okay.
Cardiac-wise, his, as I mentioned, his heart rate was 66. It is sinus rhythm, though he does have a history of paroxysmal AFib. He does have some pitting edema in his lower extremities bilaterally, and it's +1. He has an OG tube that is clamped. Dietary was here early this morning. They do have some recommendations, and we'll be starting him on 2 feeds momentarily. In the emergency room, they placed a right triple lumen subclavian.
Okay.
I'll let you go over and look at it, and we'll go over the IVs together.
Okay. Let me just check his IV fluids.
All right, Joanne, in the first port of the triple lumen there, he has normal saline running at 150.
Okay.
The second port, he has Nimbex running at 0.5.
All right.
And in the third, he has fentanyl and Versed wide together. The Versed is running at 2, and the fentanyl is running at 50.
Okay. Looks very comfortable on his sedation and pain medication.
Next, he has an OG tube, which is clamped. Dietitian was in and offered her services and recommended some tube feedings, which we'll be starting momentarily.
Okay.
The skin's intact.
All right.
Any abnormal lab results, there was a lactate of 13.9 on admission. They gave some fluids down in the emergency room. That's come down to 5.9. All the other labs are really benign. The CBC is normal, and the BNP is also normal.
Okay.
So just a little bit of review. He's on the hypothermia protocol. He'll be on that till 2 o'clock this afternoon. And he's on adequate sedation and pain control. And we're just waiting for cultures pending. His x-ray kind of suggests maybe some pneumonia or a possible PE. The doctors were talking about possibly sending him for a VQ scan. Okay?
Okay.
You all have anything to add? Any questions?
I think our main concern is that he's not in any pain, that he's comfortable and not in any pain at all.
Absolutely.
Absolutely. And he is on some medication right now to keep him pain-free. And he is sedated as well. So certainly want to honor your wishes.
Thank you.
All right. I'll be here for 12 hours, so you will see me here every hour or so. Like Jamie had done in his shift, I'll be turning him every 2 hours. We'll start his tube feedings. As you can see, he's got an OG tube, so it's where his special formula will go. And did he have any blood sugar check ordered?
He did have a blood sugar, thank you for that, for his diabetes. It was 172 this morning, and
Okay.
it was covered with 4 units of insulin. And he has a AccuCheck every 6 hours.
Okay. So, I guess that's it. If you have any other concerns later, there's one thing that I would like you to think about if you would want chaplain to be consulted for emotional support from Mr. Gervais. Would that be okay?
Thank you.
Okay, so we'll put that in
Definitely, yes.
his chart. So we'll be expecting the person to come in anytime this afternoon, and I'll let you know. Okay.